Hey guys, Dr. Ray Marque DC here at local chiropractor Back Pain Relief Center. We're here today with Alex, and she's got a little bit of lower neck and left shoulder pain, along with a little bit of low back pain. So we're gonna do a little bit of muscle work on her and an overall body adjustment, and get her to function and feel just a little better. All right. So Alex, first thing I'm gonna do is gonna move your hair to the front a little bit. I'm gonna put a little bit of pressure on your shoulders, and we're gonna kind of loosen these upper trap muscles a little bit. Okay. So look down and up for me about 5 times. So I'm gonna have this go a little more of a pull. There you go. Then come up. That's 1. Again, 2, 3, 4. 1 more. 5. You okay with that? Not pushing too hard?
No.
Why don't you turn your head to the right and go up and down for me 5 times. 1, 2, 3. We're already popping a little bit. 5. Okay, other side. 1, 2, 3, 4, 5. Good. Can you lay on your belly for me, please? So face here and kind of hands just hanging down the side.
Here?
Yeah, you can move back. Oh, you got it up. Even better. So we're going to do a little more muscle work on you, okay? You can kind of just hang those there. So what I'm going to do is just put some pressure on these tight muscles, and I'm going to have you move your head a little bit for me. So I'm going to put a little pressure there. Can you look this way for me 5 times? 1, 2. What we're doing is trying to break up some of these trigger points or muscle knots. I think that's 4. Give me 1 more. A little tender. I'm sorry. 5. Okay. And again. 1, 2, 3, 4, 5. Good. All right, now we're going to move to the other side. Try this one 5 times. 1, 2, 3, 4, 1 more, 5. Good. Okay, one last time, a little tender, I'm sorry. 1, 2, 3, 4, 5. Good. You okay?
Mm-hmm.
Okay, take a deep breath for me. Just blow it all out. Just a little light adjustment there. There we go. Good. Good. Go on your back for me, face up. All right, so next thing we're going to do is a cervical adjustment. And just nice and light. Good. And 1 more. Good. All right, come on up and we'll go back on your belly. Okay, and we'll just hang those hands there. So in order to adjust your low back, we're going to do a little bit of muscle work on our low back. So Alex, I'm going to move your leg in and out just to stretch it a little tender under my thumb. And what we're doing is just loosening the muscles up and allow for better adjustment. The manipulation will go a little easier. Just loosening it up. A lot of tension can build up there from working out, sleeping a little wrong. That side's a little tighter, Alex.
I think I lean to the right.
Do you lean to the right a little bit? Good. All right. Can you lay on your side for me? Face me.
This way?
Other side. There we go. I'm going to kind of put you where I need you. So I'm going to move that out a little bit. So next thing we're going to do is a lumbar adjustment. I'm just going to decompress the joints a little bit. That's it. Okay, the other side. Nice and light. A little lighter on this side, Alex. Okay, just nice and light. There it goes. Okay, let's go back on your stomach. Good. So what we're going to do is just check our leg length. When a lot of patients come in, if they have a little bit of back dysfunction, a leg will appear a little shorter because the pelvis is rotated. But since we just adjusted her, that looks pretty good. Come on up for me. Sit on the edge of the table there. We'll kind of face the window. This last one, I'm just going to cross your arms. Okay, chin down to your chest. I'm going to lay you back, but just keep your chin down and your legs down. Come back, nice and light. That's all. 1 more time. Good, I got it. All right, Alex, that's it.
Awesome.
All right, guys, thanks for watching. If you have any questions, make sure you message me or shoot us an email or just stop on in. Have a great day, and we'll talk to you soon.